Hello and welcome to another edition of Turnpaugh Talks. Today we have Dr. Ross, and we're going to get to know a little bit about Dr. Ross, a fascinating functional medicine doctor here. And so start off by telling us kind of your background and how you got here.
Absolutely. Well, first I want to say thank you for letting me be on this platform here. It's a great talk, and I'm excited to be a part of it here today. So my training is in chiropractic. I got my DC, Doctorate of Chiropractic, in 2018 here. During that time, I knew about functional medicine. I was surrounded by people who were in the field already and knew how impactful it was and how powerful it was to patients and sick people. So I made sure during that time of mentorship, I included that in my training on the side. So I was kind of double dipping as well as getting a master's in nutrition as well. So kind of juggling three large balls in the air at one time.
Yeah.
Went and did that path. And then how I got connected with Turnpaugh Health and Wellness Center, I was finishing up my last rotation, and I kept asking, who's the big names in the field of functional medicine? And time again, Chris Turnpaugh the name kept popping up. And so I said, I'm going to go out and reach out to Chris Turnpaugh. And sure enough, he was just outside where my wife grew up, about 45 minutes where my wife grew up. So it was an easy change. We came and got connected with Dr. Turnpaugh. And it's been history and magic ever since. So yeah, that's kind of where I've been and where I'm at now.
That's great. So important, you bring up the chiropractic and the master's in nutrition along with the functional medicine. I think it's a really nice approach. A lot of people in the chiropractic field drift towards functional medicine, and they forget about the chiropractic care. So it's brilliant that you continue to do the physical medicine. And, we don't, such an important part of overall health to keep yourself moving correctly in alignment and keep your nervous system working correctly.
Absolutely. And I have to, remind myself occasionally, not to forget or focus so much on the physiology. Physiology is a huge aspect, in regards to the blood work or the blood chemistry when I reference physiology. But to remind myself, that the nervous system and making sure the body's in alignment and the body is moving appropriately is huge. And then, nutrition speaks for itself. That's such a impactful health area or health field or demographic there. And it just makes sense from a functional medicine standpoint. We can't just focus or hone in onto one specific demographic or one specific space of the health field. Functional medicine, as any good functional medicine practitioner knows, that it's a amalgamation. It's multiple areas that make up a healthy individual, not just one.
And you kind of practice that. I mean, we were just talking earlier about diet, what you had for breakfast and so forth. Right. But you're in the gym a lot too. You're working out a lot, but you're doing it in a healthy fashion. So talk a little bit. Did you do a lot of work with athletes even before you went into chiropractic school?
Yeah.
Right?
So athlete was, second nature to me. Growing up, being an athlete, playing three sports, basically playing a sport all year round, only knowing athletics, at a young age. So that was ingrained into my fiber, into my genetics, to be honest, at a young age. And knowing how impactful it is for structure of a young female or male individual growing up. And then, it being incredibly beneficial to sporting healthy, sporting good health. And then also what people tend to forget, it's, a really good stress reliever. Yeah. And a lot of people in today's rat race of the world, it's hard to find a good stress reliever. And I definitely benefit from the endorphin and the enkephalin rush that we get after that exercise high that everyone talks about afterwards, that really clears my mind and makes me a better practitioner. But to answer your question, I love being in the gym. I'm a little bit of a lughead, I'll admit that. But I like playing with my physiology, taking a certain workout routine and then pairing it with a certain nutrition plan and seeing what that does to my physiology from a physical and chemical standpoint. Yeah. And I know you like doing that a little bit too. Yeah.
Well, I love how you kind of really dig into it and you go deeper than a lot of people do. And, it's kind of refreshing to see you living it. You're taking the time, making the time, getting to the gym. It's not, it's the first thing that goes for a lot of people. But I know for you, you're dedicated to your craft. And your craft is not only what you do at the desk with a patient, it's what you do with your life outside the office. So
absolutely. I couldn't agree more. And I think it's crucial. If you're going to be able to advise patients and if you're going to be able to consult with patients, it's important, that you walk the walk and talk the talk as well.
So if I remember correctly, you did your master's thesis on soluble and insoluble fiber, right?
Yeah, that's correct. Yes.
So it's kind of ironic how you can see the deep rabbit holes of each aspect of nutrition. So, a lot of people are hitting the high points like paleo, ketogenic, vegetarian, and then you dug really deep into fiber, but not just fiber, soluble and insoluble fiber. And I will say, knowing you, it's kind of how you address everything. Like you get really deep into a lot of the subject matter you get into. So it's not just, hey, this is what we do, eat this way, clean it up, see you later. You dive and dig really deep into a lot of the physiology.
Yeah, and I think that's crucial. The old saying, everybody knows the devil's in the details. So I really I think it benefits me and the patient that the more detailed you can get into the understanding of the physiology, it's easier to correct said physiology. It's easier to make those changes. I truly believe, the more micro changes we can make will end up showing in large changes altogether.
Well, it also bodes for the individuality that you give to a patient because it's not a one size fits all. Right. This is what we do. You say this is how I look at you, but I might not look at your spouse or your sister or your brother the same way. Father, brother, next patient. Everybody. It's the devil, you said, is in the details. And so often I see functional medicine cookie cutter. Okay, here's what we're going to do. Here's the diet for you. Here's what's going to go. And you really individualize it and dig deep into that.
Yeah, so. and as you know, Doc, that's crucial. That's what separates us from the daily practitioner. That you always have to remember. I always think in my head, fingerprint. Not one fingerprint's the same. Yeah. And that's the same approach that you have to take with the patient. There is not, there may be generalities that we tend to follow, but you don't have to stick to that generality. You can deviate. You can curtail to the patient's needs, and always remembering that fingerprint. Not one is the same.
And I also know you're a little bit famous. So some patients that were over from Europe. We have some patients from Europe. I had some from England, some from Germany come over, and they just wanted to meet Dr. Ross. Dr. Ross, he's the famous person because he does a lot of the videos You've done a lot of the videos in the office. And by the way, you take pride and you do all that research yourself. You look into that yourself. Nobody's giving you that. You're digging into that. Tell me a little bit about that.
Yeah. So there's some painstaking hours behind it. That's for sure. But I love this profession, and most importantly, I want patients to be able to get credible knowledge because. As patients are probably aware, you can go on Dr. Google and really get into the whole, and really start questioning things and wondering if things are heading in the right direction. So it's nice to be able to get information from credible sources that have vetted the sources, that have spent the time and been able to disseminate this information appropriately. And most importantly, my biggest thing is being able to take home tangible action points.
Trying not to talk over someone's head, just trying to let the patients know. Another point too is, these videos you're doing are really for kind of the public good. It's not like, hey, I'm going to leave you hanging, come in here and I'll tell you the answers. It's more, this is the information. If you come in here, great, but use it for your benefit. You're really just educating the masses altruistically. Like, I just want you people to know this stuff. So is that correct? You're just giving general information. It's not like with a hook. Like,
Right.
oh, we'll tell you the rest of the story if you come in. No, it's not that.
You nailed it, and that's not the reason I do it. The reason is for, like you said, altruistically. Like, people need this information. It's really crucial, and they don't need to pay some subscription to access this information or video or that cliffhanger. This is actionable information that I would like viewers and people that are out there desperate, looking for answers, looking for other opportunities to become healthier and more optimal in their everyday living. Whether it's becoming a better family member, whether it's becoming a better person, a better employee. Health has a way to change all of that.
Yeah.
So if I can make a small change and allow them to have access to that, that's enough. That's more payment than I could ever ask.
So you're like a movie star. That's they come down and like, hey, you're Dr. Turnpaugh. Get out of the way. Where's Dr. Ross? I've been following him. I'm like, you flew in from Germany. Yeah, whatever. Get out of the way. I'm going to go see Dr. Ross. Where is he? You were walking down the hallway one time in the office. I had a patient, and they kind of caught, is that Dr. Ross? Can I say hi? He's like, can I get his autograph? And I just sit back. Yeah, I know him. I can get you a seat with him. I can get you a seat with Dr. Ross. See what's going on. So you actually were a lacrosse player, correct?
Yeah, that's correct.
Yeah. Did you play that in college?
Yeah, all 4 years collegiate. Started 3 out of the 4. I had to pay my dues my freshman year, but it was good for me, and it was a great experience. Something I'd never, definitely never regret. So it was amazing.
Now, I don't know this. Did you have an injury or a need for functional medicine, chiropractic care? Is there anything that really influenced your life? I know a lot of practitioners have been driven this way based on personal experience. I don't know if you were just one that didn't need that personal experience or what.
As more when I was in my adolescent years, I noticed more importantly the nutritional piece. So I definitely had some learning disabilities younger.
You had a learning disability?
Yeah.
That's hard to believe. Like, he operates at like 1,000 miles an hour, superconductor. So, good grief. Yeah.
So, and I didn't, love my parents. They're great.
You didn't love your parents?
Wait, I love them. But the, prelude into that is we probably didn't have the best diet growing up. We probably had the sad standard American diet.
Yeah.
Bingo.
Yeah.
So, nutrition wasn't the best. And I definitely had there was a couple of years there where I had some like OCD tendencies.
Okay.
And like, I knew some of these thoughts like weren't normal. I'm like, what the heck's going on? Why am I like, I know this isn't right. So, I decided to take, action in my own hands with, my older brother. I talked to him a little bit, who's in the field. Okay. And, we made some simple changes, corrected my nutrition, ate well, ate a low inflammatory diet, high in nutrient dense.
So what do you mean when you say low inflammatory diet? What does that mean to you? Like, how can we explain that in ABC terms?
Yeah. So low inflammatory diet is obviously we're going to like remove processed foods. So basically, like, for people listening, avoid the middle aisles. Shop the outside of the grocery store. If you're shopping down the middle aisles, granted, you might be able to bring up a food product with, that defies this rule, but for the most
stuff that looks like it came out of the ground, right? So
Bingo.
You don't read the ingredients on an apple.
Yeah, exactly.
Right, okay.
Exactly. So we got rid of, the junk, the processed foods, the refined carbohydrates, the genetically modified foods. And we stuck to what, like you said, grows out of the ground, and that's nutritious, lots of vegetables, lots of protein. Being an athlete, wanted to make sure I had good recovery and tissue regeneration. And through that, in basically a matter of I believe it was about 6 months, lost a lot of weight. I was a heavy kid growing up too, but I didn't have no longer was suffering from some of these OCD tendencies and aspects like that.
You noticed the big difference really in your brain.
Yeah.
So that's fascinating to me because currently the office in general is writing a book on childhood emotional issues. And in your case, you didn't take an antidepressant or anti-anxiety medication. You changed your diet, and that diet had a massive influence on brain function.
Yeah.
So I think that's a very underserved section, and you kind of masterfully can weave around that and speak from a physician doctor standpoint, but also from a personal standpoint.
Right.
Like I've been in that field, I've been in that hole, and I know the way out. So
exactly. So that's kind of how I connected to this a little bit more, and then again having being around people who practice functional medicine and seeing how that affected how they were able to affect their patients' lives very just dramatically, really helping them with a lot of their health conditions.
So it starts with diet.
Yeah, absolutely.
Yeah, diet and moving. So as we were talking about the hand of health that I had, how and when you eat, how and when you sleep, how and when you move, and then supplements and medications if you need to. But how and when you eat, I think, is so crucial. So are you still on that type of a diet?
Yeah, I usually... like we were talking about earlier, we like metabolic flexibility, like to be able to bounce around.
Metabolic flexibility, what is that?
Yeah. So basically, when our body uses our fuel, it uses two primary sources. We're going to be using glucose as our additional, our primary fuel source. And then it can bounce over to ketones in starvation mode. So I tend to...
what does it take to get into starvation mode? So I have to not eat for a month and a half?
No, you're not going to... So basically what you do is you try to limit your carbohydrate intake. So a lot of viewers are probably familiar with a ketogenic diet. Right. If you're not, it's like just a high fat diet. And they recommend carbs to be somewhere around 20, 30 grams of carbs per day. And that can get, you can use your glucose stores up sufficiently to switch over to ketones, which is another fuel source.
So how long, I have my sugar that I stored in here, and I store that in my liver and muscles, right?
Right.
Okay, so I burn through that, and then I start using my fats,
right?
Which is ketones, you're saying,
that's
right?
correct.
So that's ketones.
Correct.
And so how long does it take me, do you think? I know it's variable probably, but how long does that take, like a month or how?
No, you can like there's people that have reported to be able to get into ketosis in just a 72-hour period.
Okay.
So it could be that quick. Again, it depends how metabolically adapt your body is. So there's people that can, get in and out of ketose relatively easy if they're already in it. But it's something that doesn't take a ton of time, but I do recommend if you want to have that metabolic flexibility, meaning you jump back and forth from glucose as your primary fuel source and ketones as your primary fuel source, that you have a way to measure that and judge that. And
I can burn on two different fuels, like diesel and gasoline.
Bingo. Yeah, exactly.
Okay.
Exactly.
So now, I want to clarify one thing, because you said glucose is your primary. You're not telling me to eat sugar.
No.
Okay.
So we can get glucose from basically all of your macronutrients except for fat. Fat is typically going to break down. So when I talk about macronutrients, that's your carbohydrates, your proteins, and your fats or fatty acids. And then
where does alcohol fit in? I think that's a different one. I always heard that was the fourth.
Well, some people are arguing now or debating for a ketone, ketone to be your fourth macronutrient.
Don't ketones come from fat metabolism though?
They do.
Okay.
Exactly. You're right. Okay. Spot on. So that's another reason why a ketogenic diet is catching so much popularity, because if you can transition into that starvation mode, you're going to start lysing your adipocytes. So basically, you're going to start breaking down your stored fat, because your stored fat will carry these ketones.
So let's go deep for a second here. It may be some listeners may follow and be, but others we may lose them here. Right. But so when we go into that Mtor pathway, right? So that Mtor is a gene expression of building, right? So, and that one is activated when we are fueling the body. So if we have enough fuel, the body's like, I'll grow. And if I don't have enough fuel, it's not going to grow. And that's that Mtor pathway. So what do you do to and I'll just keep it simple for my simple brain. Like, it's really switching on and off mTOR.
Yeah,
right?
exactly.
So and other people think I can just do ketogenic for the rest of my life, but then you're not going to grow. You're not going to get healthy. So if I'm an 88-year-old man and I want to maintain muscle mass, I probably shouldn't turn that mTOR guy off.
Yeah.
So how do you play with that back
Exactly. And that's a really good point, Doc T. That's for the viewers out there, listeners out there, Doc T does a really good job of taking what's a really complex topic here and presenting it in pretty simplistic manners here.
You see, I teed it up and then handed it off to the expert here.
So it's really important to realize that when we're constantly pushing a certain pathway, we have to be cognizant of the possibility of blunting that pathway or even shutting down that pathway. So there is really good. That's where metabolic flexibility comes back full circle.
So you wouldn't keep somebody like ketogenic forever.
No,
you might push them back. That's what you're saying. Burn some carbs,
right?
Then burn some fats,
right?
Yeah.
And that's one of the ways I will use nutrition, nutritional medicine. Essentially, here's what we're talking about to increase responsiveness to certain genetic pathways or metabolic pathways that we're trying to push here. Yeah. And so another way we can do that as well, talking about bouncing back and forth from glucose, again, which we can get from various macronutrients, not just sugars, and back to ketones, is some intermittent fasting as well. It's another nice way.
So intermittent fasting, what do you mean by that?
Yeah, so typically the words are connected with that. A lot of people will hear like an 18-6 or something like that is typically where it means you're fasting for like 18 hours, you're feeding for 6 hours, something.
So that sounds intimidating, but you sleep for a lot of that, right?
Exactly.
Yeah, so you're sleeping.
Bingo, exactly. So like you could typically, I would tell my patients, stop eating around 7 o'clock, 6 o'clock, something like that, which most people are having dinner around 6, 7 o'clock. And then you wake up, just get past that urge of eating at breakfast, and 11 o'clock usually is when you can start your feeding. And then make sure you have your adequate nutrients during that feeding hour.
Feeding time.
Yeah, that's the one thing that's a little bit that people miss is we still want you trying to get your normal caloric intake in. You're going to go into somewhat of a caloric deficit, meaning you're not going to eat as much food as you normally do when you're, not fast, when you're eating, 3 square meal breakfast, lunch, dinner, but you are going to go in a caloric deficit, but we still want you to try to consume your adequate amount of calories.
So we talk about, and I call it the hand of health, right? Yeah. So how and when you eat, how and when you sleep, how and when you move, what supplements you need, what medication you're taking, and then we extend that hand to community, so it's a sense of community and caring and compassion. Right. But it sounds like if I come in to see you as a patient, we spend a lot of time and effort and energy on how and when you eat, right?
Absolutely.
So that doesn't even cost me any money.
No.
That's just dietary changes and choices and lifestyle. And then, so if I come to see you, because I know this to be true, you don't see just weight people.
No.
Like I think one of the maybe less known is you can serve and support a patient from hormone deficiencies. As I've looked at the videos you put out, like when is SIBO or small intestinal bacterial overgrowth, hormone insufficiencies, Lyme disease, but all of these conditions that have names still have to start from a healthy foundation. So I think talk a little bit about the breadth of cases you see, because it's not a pigeonhole of I only see the thyroid cases. That's because that's still based on physiology that's gone sideways. So you see it all, right?
Absolutely. So it was today was a nice day. I came to the office today and had a nice message from a patient who I've been working with for about the past 9 months here on growing her family. And I got to the office today with a nice message saying that she is now conceived and she's pregnant.
That's a great job. That's a great job. There's no greater gift than being able to give the family the ability to have a family.
Exactly. Yeah. So that right there, that just
makes... So I could come... No. I'm not going to have a kid, but
I'd be worried if you're coming.
right. But infertility.
Yeah,
so we're sitting here talking diet. People might
Yeah.
think I'm only going to go for weight management, but really infertility
Yep.
plays a role in that.
Yeah,
So,
infertility.
again, I guess that would make sense. So if we're going to grow,
Right.
we don't want to restrict growth.
Right.
So I want that mTOR pathway to fire so I can
you
grow
go.
a baby.
There
So
you
that's
go.
great.
Yeah. So that was a nice moment today. And then, like you mentioned on briefly, it's not just the weight loss or, just the hormone patients patients are having with hormone issues, but a lot of people with autoimmune issues who are struggling.
It's a big word.
Yeah. So autoimmune basically just means that you have some kind of symptom or condition that the immune system is attacking self.
Right.
So you've now created some what we call immune dysregulation, and the body is now recognizing self as foreign. So there's typically environmental factors that go on with that. There can be some genetic variants that go along with that, and also recognizing that there's an emotional piece to that as well.
Yeah, so it's very important. I've personally seen, and I'm sure you have too, is a lot of these patients are told, well, you got it, there's nothing to do for it, which in and of itself is emotionally degrading. Like, yeah, you got this, you're kind of in a bad situation, we'll manage it, but it's never going to get better, it's never going to go away. And first of all, that's not the hand of compassion. That's not the hand of caring. That's not the hand of community.
Right.
So I don't love that approach.
Yeah.
We don't want to lie to patients to give them false hope.
Absolutely.
But these patients, you've seen many of these patients turn around when they've been told there's no hope.
Right.
So there is some hope and understanding that immune imbalance. So talk to me a little bit about how would it be typical for a patient to be told by their other physician, there's nothing to really do about this.
Yeah.
And have you seen changes in this patient?
Yeah, absolutely. So typically, just to comment on that, I strongly believe the two biggest things as functional medicine practitioners that we can give a patient, hands down, two biggest things, hope and love.
Wow.
That is crucial. Without hope, without love, there is no healing.
But if you're doing the hope out of love, you're not giving them false hope.
Right.
You're not saying I can turn me into an NBA basketball player.
Right.
That's false hope.
Right.
It's not going to happen.
Yeah.
And you're not going to turn brown eyes blue.
Bingo.
But you are staying out of love.
Right.
I'm going to give you true hope.
Right.
Real
Exactly.
hope. And that changes.
Right, exactly. And we see changes in physiology. When we take the functional medicine approach, we make sure we're addressing all avenues of the health paradigm. We can see ANA markers turn down. We can
That's
see
an autoimmune marker?
Yep.
Okay.
So all these markers I'm going to be mentioning here briefly are related to an autoimmune condition with X name associated with it. So we can see thyroglobulin antibodies, thyroid peroxidase antibodies actually downregulated.
They're tied to thyroid, right?
That
Yeah,
is.
thyroid.
Rheumatoid markers, so tied to rheumatoid arthritis, psoriatic arthritis, various arthropathies have actually come down, and seeing patient symptoms improve, and making sure we address it from the entire body that is health. A lot of the times the patients come in and it's the typical, run of the mill that they've been on some type of cortisone, some type of, heavy
Steroid.
steroid, heavy and anti-inflammatory. Then they move to like a methotrexate, something that is that shuts down the immune system. And usually then we bounce around to different immunosuppressives. And that's kind of the case that we see. And I don't necessarily know if that's for the right approach with a lot of the patients that we see.
Well, it seems to me, again, my simpleton, if my immune system is attacking me,
Right.
instead of killing the immune system, why don't we tell the immune system, hey,
Right.
pal, stop attacking me.
Right.
Get regulated, right? You start attacking the bugs.
Exactly.
Which kind of brings me to another topic. So I know you've become an expert in Lyme disease as well. So you see a lot of these, you get this post-treatment Lyme syndrome or chronic Lyme, which some people say don't exist, which we know it does for a fact. And they have all these symptoms. and then they start to exhibit. Don't they exhibit autoimmune type things?
Yeah.
So talk a little bit about how Lyme disease can really present like this.
Absolutely. So commonly we can see something called like polyreactivity. Basically what's going on with a lot of the Lyme patients is that we have immune dysregulation. For the Lyme experts out there and those who aren't, those experts are aware that when we have Lyme disease, it loves to wreak havoc, whether it's typically creating immune dysfunction, which creates this polyreactivity. So we can see a patient who has Lyme disease, they had an initial infection from a spirochete and then developed a thyroid condition, developed a skin condition.
So when you can actually see, so I might assume it's purely thyroid, but it's really not?
Right.
Okay.
Right. Exactly.
So you got Lyme disease and it screwed up your thyroid, and then some people are treating the thyroid.
Right.
Okay.
Exactly. And because there's there's still a lot of question marks with appropriate testing when it comes to Lyme disease.
Right.
A lot of patients come in and they have gone to their the hospital that's local to them and have run just an ELISA an ELISA test for
SNAP ELISA.
Yep, exactly, for a Borrelia burgdorferi, and there are multiple tests that include Borrelia burgdorferi that evaluate that. That's your Lyme disease and co-infections of Lyme disease, most commonly being like the Bartonella or the Babesia and the Ehrlichia. Those are your three more common co-infections, but there is a lot more than that for our listeners out there who aren't aware of Lyme disease.
And you test for all those?
We have to.
Yeah.
We have to do our due diligence.
So how often do you have somebody that comes in that tested negative for Lyme disease, but then you test them and it's positive?
Yeah, pretty frequently.
Yeah.
Pretty frequently.
So that's another hope. What's worse is to tell somebody there's nothing wrong with them when there actually is something wrong with them. So, and those patients typically wind up on psych meds because they're told they're crazy.
Exactly.
So you're seeing this thyroid, which might be from Lyme, you're seeing, and I'm sure it affects other tissues and other pieces, and it really do a deep dive into testing for not just Lyme disease, but the co-infections through detailed testing, which is missed because it's not even run other places, right?
Right,
yeah.
Exactly.
And then do you have pretty good success with treating that?
Yeah, we've got great success. I don't like to say that we are a Lyme clinic, but I would think, if I had to...
You're Lyme literate, right?
Yeah, we're definitely Lyme literate. But we have, when it comes to Lyme patients and taking care of Lyme patients, we do, I hate not to toot my own horn, but we do a pretty good job at Turnpaugh Health and Wellness.
Yeah, I would agree. I would agree with that statement wholeheartedly.
Yeah.
So Lyme disease, chronic autoimmunity, even weight loss, and then... what other types of patients? I mean, what about so let me just say, my background is chiropractic too, but you might be tying chiropractic into all those conditions as well, right?
Yeah. I mean, when there's inflammation and stress in the body, there are various ways that the body can basically present with that condition. And a lot of the time the nervous system gets affected traumatically. And anyone who has been to a chiropractor or studied the profession, they know how important the nervous system is to the chiropractic profession, and how crucial proper nerve function, nerve firing is to the body as a whole.
And the immune system too.
Yeah, absolutely.
So you also have some other therapies here that you utilize. One's the hyperbaric, right? And IVs.
Yep.
And so just walk me through, not the PhD level, but the third grade level of hyperbaric and the IVs. So.
Yeah, so hyperbaric is huge. I think that is one of our best services right there with IVs to offer to patients, to be able to have that for patients. So hyperbaric oxygen therapy traditionally was brought up for wound care or burn victims. people might remember that they're not quite the same, but remember those pictures of the people with their heads sticking out of the chambers with polio.
Like the polio, the polio lung.
Lung.
What do they call it?
The iron lung.
Iron lung. Right, I was going to say metal lung, but the iron lung. Right. Yeah.
So kind of similar, but not to that degree.
Yeah.
So you get into this chamber that you step into, and we zip you into a chamber that becomes pressurized, and we pump a higher percentage of oxygen in, so you're breathing a little bit higher percent of oxygen.
Yeah, so that's an important distinguishing factor, right? So not everybody does that. So you use an oxygen concentrator.
Yeah, that's correct.
So that puts almost pure oxygen, right?
Yeah, yep,
right.
Exactly. So we hook them up, and they're getting basically around anywhere from 97 to 98% pure oxygen.
Okay.
That they're
while they're under
they're under the pressure as well. So you get exposed to oxygen, pure oxygen concentration, and the pressure, which there's research out there that's been showing that oxygen and pressure actually can affect the genes and can change the expression of certain genes.
That's fascinating.
Yeah.
Now I was walking back there today and I saw them. They give molecular hydrogen afterwards.
Yeah.
Right? So oxygen can cause iron to rust or create oxidative stress.
Right.
And I know you guys give hydrogen.
Yeah.
So oxidative stress is an OH.
Right.
You add another H to it, you get
Bingo.
water.
Now
So
you're
you see again that push-pull. We're pushing to create this oxidative stress to heal and change gene expression. But we want to also not keep you there.
Right. We're going to support you afterwards. Exactly. So we see this a lot with, I know I mentioned what it was originally intended for way back, 20, 30, 40 years ago. But now we're using it with a lot of concussion patients. So anyone, that's an athlete that's experienced some type of either mild to severe head injury, or even to the point where maybe you slipped and fell and you got your bell rung a little bit, but not to the point where I've passed out or diagnosable mild concussion. We're using a lot of the hyperbaric with a lot of these patients with great success, because oxygen is crucial for the repair of neurons and for the brain tissue.
And you guys do a concussion screen.
Absolutely.
You do a full concussion screen.
Yeah,
so I know people come in for a concussion, you give them a quick screen, make sure everything's okay.
Absolutely.
And that's crucial to get them early, right?
Right.
You don't want to wait around. You want to get them right away.
Exactly. As soon as you have an event, reaching out to the office, and making sure we get you in as soon as possible, because timing is everything with a concussion. Everything. Also, our Lyme patients do very well with hyperbaric oxygen therapy, so that's another modality that's very helpful. And then we'll also use it with our autoimmune conditions. Our patients who are suffering from various autoimmune issues, the oxygen helps in basically balancing and kind of leveling out some of the immune system. So we notice a nice reduction in symptoms with our autoimmune patients in hyperbaric as well.
Excellent. You do IVs as well, right?
Yeah, and that's another one. I would say that is a game changer for patients.
Yeah.
Whether it's...
Now you're not talking about giving drugs through IVs.
No, we're talking about like nutraceuticals here that are put into a liquid form or made into a solution under expertise, someone who is credentialed and has gone through schooling and is legally allowed to administer these appropriately and safely. We give these nutraceuticals via IV, which... one of the really nice benefits is any patients who are suffering with what we would call intestinal permeability, commonly known leaky gut, their microvilli have been damaged, so they're unable to absorb nutrients as effectively or efficiently. This passes that gut absorption, and it also passes what we would call the first pass of the liver. So a lot of times when we take a medication orally, the stomach will digest or start to break down that said supplement or drug or whatever that you're taking, and then it has to go through the liver to be metabolized, and then it gets
distributed.
Thank you.
And that's called the first pass.
Yeah, that's the
first pass.
Right, exactly.
So everything you eat has to be processed by the liver. Yeah.
Bingo, exactly. So that can also, decrease the potency and the efficacy of said supplement
and
or
be
drug.
hard on your liver, maybe. Right?
And hard on your liver. So that's why detoxing liver is such a popular concept, because we're in a world that's basically sick.
Yeah.
And we're
you just did a talk on toxins.
Yeah.
Did you release that yet?
Yeah.
So it was good. There was a talk on toxins. So
Yep,
again,
exactly.
every subject you speak on is so relevant. Like whether it be leaky gut or whether it be toxins and all this burden.
Right.
And it plays a role, because if you can't absorb your nutrients correctly because your liver's not, all that stuff.
Right. So that's another really nice aspect of the IVs. We get to avoid the digestion. We get to avoid that first pass of the liver. So we get a nice potent, safe though, everything we make sure is safe, but we get a nice potent dose, or a therapeutic, what I would like to call a therapeutic dose of whatever nutrient we're trying to deliver to the body. So that's really crucial for our chronic fatigue patients. As you're aware of, Doc, in the legitimacy and the research behind NAD for the use of chronic fatigue, which is crucial. So we have a lot of success with that, and also for the support of NAD and mitochondrial dysfunction. That's another really
and mitochondria
nice
make energy.
Yeah,
right?
that's your powerhouse, right? Yeah. That's the little engine that could, and we've got thousands and thousands and thousands of these mitochondria that help to produce energy.
So let me give a little shameless plug for the Spring Summit. Since you're the movie star, you're going to carry the weight here. When is the Spring Summit this year?
25th to the 26th.
Of April 25th to 26th. For those that are interested, it's open to physicians as well as the public to learn. And so, movie star, what are you speaking on there, right?
Yeah, so we're going to be talking about mast cell activation syndrome, so MCAS for short. Basically, we're
what now? So that day is going to be 11 providers. Right?
Yeah, there's going to be. We're going to have
world class.
We're going to have a star-studded cast that day of providers. We've got a lot of providers that are going to be coming that are going to be talking on some serious content and knowledge, and it's going to be a day that is, I'm excited for it, because I know how valuable it's going to be for a practitioner, and it's one of those talks that brings you to the elite level and really allows you to confidently go into work that next day, and whatever's staring you in the face, whatever condition, confidently handle that and know how to approach that.
And I know too that for a patient walking off the street, it's going to give them knowledge that they're going to be able to go back to any practitioner and say, I need to check for this.
Bingo.
Like mast cell activation.
Right.
So what is that?
So just we're not going to dive into it here because we'll be here for another 3 hours. But
give me the overview.
Yeah, exactly. So mast cells are, part of the immune system, and they live typically in our lungs, our skin, in our gut. And when there's a little bit of, let's just say, for lack of better words right now, a little bit of chaos going on in the body, the immune system upregulates these mast cells, and these mast cells start to release histamine. Anyone, has had like a little bit of pepper or a little bit of spice, that's kind of that similar response. Or better yet, say you got stung by a bee and you get that red spot that kind of swells. Well, that's a histamine response. So a lot of swelling, a lot of redness, you can get a lot of irritation. And with sick people, we can have this constant activation.
So I'm constantly swollen.
Yes, you're constantly
irritated.
Bingo. So it's constantly, you got that bee sting, but it can be your entire digestive tract. It can be your entire integumentary system, skin, and it can be your entire respiratory system that's constantly irritated. And in sick individuals who have immune dysregulation, they can have this overactivation, this constant release of mast cells that create this irritation.
I can't wait to hear that talk.
Yeah,
I mean, that's chronic inflammation, which I think most of the patients out there are suffering from. Some kind of of some inflammation or mast cell something. Or
Absolutely.
Other. So I can't wait to hear you give that lecture.
Yeah, I'm excited.
We're going to video that too and make it available to all your
Absolutely,
groupies
absolutely.
that you have
I
out
mean,
there.
I gotta make sure.
Got to make sure you keep the crowds happy. I mean, you got to keep the masses happy.
Right,
so.
right.
So what is there anything else that comes to mind? We'll have many of these, I'm sure, because we're going to do these in the future, and in the future we'll do it on a specific topic. So we might take that mTOR thing, and talk for 45 minutes, an hour, like just mTOR and AMP kinase and insulin sensitivity and fancy things. But we'll break it down.
Absolutely.
What else would you like to get out on your initial? I mean, it's not your initial because you're a movie star already, but it's my first opportunity to hang out with you. So
one of my aspects that I like to target with patients, or at least analyze, is making sure that, and this is like, the more I read about it, the more I see mainstream medicine talk about this topic, it gets kind of demonized, or that's just a holistic concept. It's adrenal. Yeah, it's woo-woo. Exactly. It's adrenal downregulation, or what I would call adrenal insufficiency. Yeah. So, but the big term that's connected out there is with adrenal fatigue, and in your standard medicine, in my opinion here, do not recognize it because you can't slap an ICD-10 code on adrenal fatigue.
Okay.
And so.
So what would be some of the, so if I came into you and said, man, I don't feel good, what were some of the symptoms of adrenal fatigue?
Yeah, so it basically, we want to make sure we assess the adrenals, but what you'd be coming in, typically low energy, constant low energy, not just you woke up and didn't sleep well that day, but, dragging, kind of zonking, low energy.
Okay.
Also noticing, weight gains, unproportional weight gains. We're not talking, a pound, every couple months or something like that. But we're talking, a pretty, substantial weight gain, whether it be 5-10 pounds over the past month or 2 months or something like that. So weight gain is another big issue. Some depression and anxiety. A lot of patients who are just that constant fatigue are depressed, rightfully so, and have anxiety, rightfully so.
How about that term brain fog? Does that fall into
that's
that?
a huge one. That's a huge one. So a lot of patients...
What is brain fog?
Yeah, that's what patients ask very, very frequently. And literally, I tell them, like, imagine you are just walking and everything's a fog. You don't know, what direction's what. You don't know what your left is your left, where up is down. And you're having difficulty with almost word recall, like
early memory issues.
Yeah, like not.
So it's funny because I say to people, "Do you have brain fog?" And if they have it, they know exactly what you're talking about.
Exactly.
But then trying to describe it as a nebulous term.
It is so nebulous. It's like, it's not to the point where like, oh no, I think this patient has dementia. It's not to that degree, but it's to the point where like, man, I should be remembering my patient or my colleague that I see, a couple times a month, like these things that you should remember that you're just not able to come up with. That's really what I would. So
that can all be part of adrenal fatigue,
yeah,
adrenal insufficiency.
Yeah, exactly. That those can be connected. And I always make sure that I want to look at that because the adrenals can be tied into so many other body systems. So it can affect the way we digest. It can affect our brain health because cortisol, if we have high cortisol, that can basically act like a cheese grater to the hippocampus, which is an area in your brain. So it can cause degeneration in certain areas of the brain.
The hippocampus is responsible for memory, right?
Yeah, exactly.
And
hence
the cortisol is made in the adrenal gland.
Yep.
So it's just your adrenals are cheese grating this thing that's responsible for memory in your brain. Yeah.
And there's a lot of research. There's a lot of research out there with PTSD patients.
Okay.
And they take
PTSD means
meaning post-traumatic stress disorder.
Okay. I know you know that, but just for those that don't, I just want to throw that out there. So we're not all as smart as you, Dr.
Right. So they actually will do a couple ways you can measure this. Typically, the gold standard is measuring cortisol via your saliva. Okay. But you can measure it your blood as well and your urine.
Okay.
And that they they have measured the cortisol level in these patients, and they've found that these patients who are suffering from PTSD are all having these low adrenal output of cortisol, this low function of cortisol.
So cortisol is like cortisone?
Yeah, yep.
So if I get a shot of cortisone, not that I'm advocating it, but if I get a shot of cortisone, it helps reduce inflammation.
Yeah.
So if I have constant inflammation, like this mast cell thing you're talking about, it could be tied to my adrenals?
Right, absolutely.
That's
absolutely,
amazing.
yeah. And it's, people don't realize we have our own internal cortisone shot. You know, we have our own way to produce cortisone through cortisol. That's why I always tell my patients when I'm looking at their blood markers, I want the Goldilocks principle, right? We don't want too hot, too cold. And I think we tend to demonize cortisol being high all the time. Oh, cortisol's high. We don't want that. That's not good. I would say, wait a second. Let's look at some other physiology. Do we have your DHEA, which is another marker that's released by your adrenal glands, which is dihydroepiandrosterone, which is what it stands for.
That's a PhD word.
Yeah, that's one of those $1 million words there.
Yeah.
But if we have cortisol high and your DHEA is high, that's an appropriate physiological response. Let's not
You go further upstream, like pregnenolone?
We'll make sure we look at pregnenolone.
So you're looking at, you're not just saying, like a lot of docs will say, your adrenals are fine. We looked at your cortisol.
Right.
There's so much more to it than that, right? It's a whole...
It's huge.
Yeah.
And then a lot of the times what they'll do is they'll just take blood and they'll take one sample of the cortisol and say, oh, cortisol is great. Cortisol is a rhythm. It's what we call a diurnal rhythm, meaning in the morning your cortisol should come up with the sun and your cortisol should go down with when the sun starts to sunset and then it becomes nighttime. So it fluctuates.
So it matters when I get my blood test.
Absolutely. And we also want to look at some other markers that are associated with your adrenals. So that's going to be, like I commented, your DHEA. There is something called a prohormone called pregnenolone, which influences your adrenal hormones and your sex hormones. So that's a big one that we want to look into, is your pregnenolone. And then we can look at more upstream things like your ACTH. That's your adrenocorticotropic hormone that's released from the pituitary, which is in the brain. So we can actually get some markers
from the brain.
That influence your adrenal glands.
So it sounds like adrenal could be tied to a lot of things. Mast cell could be tied to a lot of things. Lyme disease could be tied to a lot of things. Autoimmune could be tied to a lot of things.
Yep.
So it's really helpful to have a kind of a general approach to all these things and not be the specialist of one.
Totally.
Right? So it sounds like you do a phenomenal job with that.
Yeah. I try to make sure we address all those. And that's what, I think that's what that modern medicine or main traditional medicine.
I would even go a step further, Doc.
Yeah.
Even functional medicine. I see functional medicine practitioners that specialize in diabetes or specialize in thyroid or specialize in weight loss.
Right.
And why?
Right.
So you ask the question, let me take a look at you as a human being.
Right.
Let me look at you as a human, not as a thyroid or a weight or a pancreas or insulin or whatever. So,
right. And we want to make sure, the old analogy, it's not just a pill for an ill. And I'll even go one step further. It's not just a supplement for an ill.
Right.
We need to make sure we address the full spectrum that is health. And that whether it comes physically, whether it comes mentally, and whether it comes emotionally.
Yeah. So, it sounds like a wonderful thing as a progression towards health, and people that come that have the mysteries would come see
Yeah,
it.
exactly. And that's usually what we see.
Yeah, I'm fast. I could talk to you for hours and hours and hours, and I look forward to further conversation. But I'd like to thank you for coming out and spending your time with us. And for those, I think people wanted to get to know the Dr. Ross, not the Dr. Ross that was teaching me about SIBO or PANDAS or adrenals, but just who you are as a human being, and realize that you're a real person that lives it, practices it, and loves it, who has been changed through his own experiences. And,
absolutely.
I appreciate you coming out.
I appreciate you having me on this platform. This is a great opportunity, and I'm just excited to be able to sit and chat with the great Chris Turnpaugh. So this is awesome.
Well, we'll do it again.
Absolutely.
I remember I said a long time ago, because we're a few years apart, I know I'd look great, but I don't know. So, the future is you. You're the future. And I want to look back and say, Dr. Ross was able to take care of me when I was long faded into the sunset. So I appreciate all your time and effort.
Absolutely.
So.
Well, thank you for having me here, Doc. Appreciate it.